The meeting, which was called by the president, was aimed at fashioning out a clear definition of who qualifies as a frontline health worker in the fight against the coronavirus. Present at today's meeting were the leaders of the Ghana Registered Nurses and Midwives Association, the Pharmaceutical Society of Ghana, the Association of Allied Health Professionals, and the Ghana Physician Assistants Association. President Akufo-Addo, in his last national broadcast to the nation on government's efforts in curbing the spread of the coronavirus in Ghana, announced incentives for persons he described as frontline staff. This announcement has since generated controversy over who qualifies as a frontline health worker. At today's meeting with the leadership of the country's health service providers, leader after leader justify why they are frontline workers. First to speak was the president of the Ghana Registered Nurses and Midwives Association, Perpetua Ofori Ampofo.
For who the frontline workers are, that has generated in a lot of disenchantment among our membership. And as we sit here, nurses and midwives across the country are very demotivated, and they are looking forward to us to get the outcome of this meeting to assure them that yes, whatever they are doing across the country is well appreciated. And it is also known to Ghanaians that they are risking their lives, putting themselves at the front of this war with a virus that cannot be seen, and doing their best. And therefore, that recognition is also very important.
President of the Ghana Allied Health Professionals, Ignatius Awuni Bono, on his part says they should also be considered as frontline health workers.
You see a lot of our members in the laboratories working under highly risky conditions. In fact, that is the highest risk level you can find when it comes to the fight for COVID-19, because the organisms are highly concentrated in that environment. What is even more risky is that some of these persons who are asymptomatic are sampled, and the samples are sitting in our labs across the country. This is the risk people are exposed to. Our members are moving around the whole country, educating people, the community mental health, providing support to those who are affected. So we are equally exposed.
The physician assistants were not left out. Their president, Emmanuel Yaapia, made a strong case why they must also enjoy the incentives announced by the government.
Already, the physician assistant is described as a primary health care giver. Somebody who will be in his facility, every client who comes there will see to that client before the client is moved into the next level if it cannot be managed over there. If we are describing frontline workers, today, are we saying that the people at the primary health care who come into contact first with the patients are not frontline workers?
President Akufo-Addo on his part says government will consult extensively before announcing a clear definition of who qualifies as a frontline health worker.
That in the risk structure in the health system, there are graduated risks. And I think that you yourselves have been honest enough to say so. And the attempt to make this definition was to respond to that graduation. And the argument that has been put here, even by the president of the Nurses Association, yes, we think that there should be a 35% allowance across the board for all nurses, all health workers, but we recognize that certain particular health workers would need an additional amount. And I think that has been reiterated virtually by all those who have spoken. That is a recognition that there is such a group of people as frontline health workers.